there is a term known as gut dysbiosis, that the gut bacteria will produce several metabolites like trimethylamine and TMAO and other principles, L-carnitine. These are all atherogenic in nature. Either they directly go into the bloodstream, or there can be a leaky gut in presence of cardiometabolic risk factors. When there are there can be leaky gut, and there can be direct invasion also. So these are various theories. It's an emerging concept. Probably in future we will be giving more of probiotics and increased fiber intake. These are the advices we are going to give for heart health. It is not actually nothing very much new, because already yogurt and curd are said to be very good for both for digestive system as well as heart. And it has been a practice in some states like West Bengal and Orissa. Their breakfast for most of the children is overnight they soak the rice, and that water they take along with a piece of dry fish if they can afford, or just a piece of onion. That is the breakfast for most of the poor rural children, and they are very healthy. Maybe curd is another thing which in Telugu states, without curd the meal is not complete. Probably that's all healthy practices which are given by our ancestors, and now it is finding the scientific background behind it. Even in China, red yeast rice is a very popular product which is shown to have cardiovascular benefits. That is nothing but fermented rice, and it is similar to our recommendation. Then there are two more diet patterns which are in the literature. One is EAT-Lancet Commission. This is actually not at individual level, but as a country or a continent, how we can get heart healthy food. This is the idea. If you look at this diagram there, 50% should be fruits and vegetables. That's what is shown here. Rest of the 50% should be occupied by whole grains or plant proteins and other items to smaller proportions. Anyone knows who is this famous figure? He is none but Salim Yusuf, very popular for several epidemiological studies. He is a lead investigator for the PURE study, where he has analyzed the food pattern of some 80 countries in 6 continents. And what they found is they scored the various diets in various communities, and they found and categorized into 6 components: fruits, vegetables, legumes, nuts, fish and dairy. So they have made recommendations, and they analyzed whoever is following these recommendations or who are in the higher intake of these recommendations had certainly an edge over others in preventing cardiovascular events. The peculiarity of this particular study is they said that even saturated fats need some amount is needed for good health. Then quick a few points about various foods and their cardiovascular effects. Refined and unrefined carbohydrates. So if you compare whole wheat atta versus refined maida, whole wheat atta is better. Sugars should be preferably avoided, especially refined sugar should be avoided. Then processed foods, that is ultra processed foods, are very harmful, and if you eat less, much better. Then about oils, 4 oils are mostly recommended: olive oil, canola oil, sunflower oil and avocado oil. For want of time, I am just showing one line about each. Dalda is harmful because of the trans fats. Trans fats are ghee, it's neutral. Nothing is in favor or against it. Then vegetarian versus non-vegetarian. Vegetarian food is preferable with respect to cardiovascular protection. Then egg yellow or white. The consensus is that you should not deny the good effects of egg only because the yellow has slightly less cholesterol. So you should, I think, allow 3 to 5 eggs per week. Chicken or mutton, better to have chicken. Alcohol in moderation, they say about 14 units per week is okay. Red wine is good for heart is a myth. Fresh fruits are always good. Dry fruits, the evidence is equivocal. Indian spices, nothing against our favor, but they add to the taste. Then phytosterols are plant-based sterols. They are supposed to reduce the absorption of cholesterol in intestine. Then there are 2 studies which have talked about good foods, inconclusive foods and harmful foods. The good foods include olive oil, blueberries, nuts, green leafy vegetables, plant-based proteins, even legumes, moderate amount of coffee and tea, and also mushrooms, and plant-based oils, and vitamin B12, and moderate amount of alcohol. So to conclude, it's very emerging science, and whatever evidence is there is from the 3 main important diets, and ketogenic diet and intermittent fasting is just emerging as a concept, and gut microbiome and CV health is the emerging science. Probably it will lead to precision medicine. Thank you.